Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Giving individuals suffering from chest pain caused by acute coronary syndrome, or ACS, an infusion of glucose, insulin, and potassium, known as GIK, does not reduce the likelihood that they will have a full-blown heart attack, but may help improve their overall outcomes, according to research published online ahead of print in the Journal of the American Medical Association. Here is some information on ACS. It refers to any condition brought on by sudden reduction in the blood flow of the heart. Chest pain felt during a heart attack or chest pain felt while exercising, known as unstable angina, are both examples of ACS. It is a potentially life-threatening condition that requires rapid medical attention. For the immediate trial, researchers from Tufts Medical Center and Tufts University School of Medicine randomly assigned nearly 1,000 patients who were likely sufferers of ACS to receive IV GIK by emergency medical services personnel or to receive a placebo of an intravenous sugar solution. The study was conducted in 13 U.S. cities between 2006 and 2011. The EMS personnel used electrocardiograms to help identify which patients were indeed suffering from ACS rather than another condition causing chest pain. On average, the participants received their IV treatment about 90 minutes after the onset of their symptoms. There was no difference between the two groups of patients with regard to who went on to suffer a full-blown heart attack. Among those who received the infusion within the recommended first hour of symptom onset, there was still no difference between the proportion of those in the GIK and placebo groups who went on to have a heart attack. However, those who received the solution were less likely to either experience a cardiac arrest or die while in hospital. We spoke with Dr. Harry Selker, principal investigator of this study, who offered some further insight.
We ran this study by having, right after people called 911, the paramedics went to their homes in the usual way, and then they started the GIK there, right there in the field. They had predictive instruments to help them identify those people who really had acute coronary syndromes, as we call it, and heart attacks. And they started the treatment on the way to the hospital and continued it for 12 hours. And then when that was done, there was a reduction in cardiac arrest and mortality that was substantial, and that is those people who got placebo, among all people with acute coronary syndrome, the cardiac arrest and mortality was 9%. It was reduced to 4% in those people who got GIK. And for those people who had what's called an ST elevation MI, that's a heart attack that's very acute, the cardiac arrest or mortality endpoint went from 14% in the placebo group down to 6% in the GIK group, which both of those results were statistically significant. We also wondered, would it stop heart attacks from happening? And no, it did not stop the heart attacks from happening, but it did make them much smaller, both for all patients and also for those ones with the particularly acute ST elevation heart attacks. So, and although we think a larger study should be done, this had about 900 patients in it. We think a larger one would be good, but we do think that there's real evidence now that if the patients are treated very early in the community by paramedics, there really is an important impact of GIK.
Today's research suggests that there may be some limited benefits to giving people suffering from ASC an infusion of GIK. Additional research is needed, however, to clarify exactly what those benefits are and how soon the infusion needs to be given in order for patients to reap those benefits. For Insider Medicine in Depth, I'm Dr. Susan Sharma.